Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing health care to the residents of the Washington Township Healthcare District for the past 60 years.
Hello and welcome. Today's presentation, Medicare Open Enrollment, What You Need to Know, is presented by Kristi Caracappa, Washington Hospital's Health Insurance Information Service Coordinator. Without further ado, please welcome Kristi Caracappa.
Good evening. I'm Kristi Caracappa, Health Insurance Information Service Coordinator here at Washington Hospital. Thank you for joining us tonight for this Medicare presentation. If you're watching on Facebook Live, you'll have an opportunity during the presentation to ask questions. If you're watching from another source, you will be able to email me, make a phone call, or schedule an appointment, and the contact information will be provided towards the end of this presentation. So today we're talking about Medicare open enrollment, and also if you're new to Medicare. Whoops, sorry about that. I wanted to first talk about the Health Insurance Information Service that we provide here at Washington Hospital. It's a free and unbiased service, and we're here all year to answer any questions that you may have about health insurance, private health insurance, government programs such as Medicare or Medi-Cal, and also if you need assistance filling out an advanced health directive or a POLST form, those forms are available in my office as well. So tonight our objectives are to provide an understanding about Medicare open enrollment, also to provide information to those who are new to Medicare or currently new to Medicare or will be turning 65 in the near future. So the open enrollment dates for those who are currently in Medicare and have a Medicare Part D or a Medicare Advantage plan is October 15th through December 7th. It's just next week. So what should you be looking at during open enrollment, during that October 15th to December 7th time period? If you have a Part D prescription drug plan with your Medigap plan, this is your chance to update your Part D plan. What you want to think about is, have you had any changes to your medication throughout the year? Does the plan you have now still cover your current medications? And is there a new plan that might be out there that might save you money throughout the year? If you have a Medicare Advantage plan, more than likely your Part D plan is included in that plan. So again, you want to look at what medications you're taking. Has the premium changed for your Medicare Advantage plan? Have the copays changed or coinsurance? And are there any other changes within the plan that might affect you? If you're on Medicare and you have an employer retirement plan, such as CalPERS or a Lockheed plan, those are the most widely ones that I find in this area. If your Medicare is through that employer-sponsored plan, you want to check with the employer to see when your open enrollment dates are. They don't always coincide with the Medicare open enrollment dates, and they may have different rules that you need to follow. So we're going to start out for those who aren't on Medicare yet and may be eligible in the future. So when are you eligible for Medicare? What is the special enrollment period? And also, what is the general enrollment period between January 1st and March 31st? So when you're first eligible for Medicare is generally when you first turn 65, or it could be if you have certain health conditions. Typically, if you're just turning 65, you have 3 months before your birth month, the actual birth month, and 3 months after to sign up for Medicare. If you miss those dates or don't sign up due to the fact that you're enrolled in a group health plan, you would have a special enrollment period. If you are currently employed or your spouse is employed and you're covered through a group health plan, you don't have to sign up for Part B when you're 65. If you're not in a group health plan, you would need to sign up for Part B, or you may face a penalty down the road when you do go to sign up. So what the special enrollment period covers is for those who were currently working and covered under a group plan and are over 65 and didn't sign up for Part B when they were first eligible. So when can you jump onto Part B without a penalty? Anytime you're still covered by a group health plan, you can start your Part B, or during an 8-month period after your employment ends, you can sign up for Medicare Part B. Why wouldn't you sign up for it right away? Perhaps your employer is going to, even though you're no longer working, is going to offer you a package that you can still be covered for a few months, or maybe even through COBRA. If they put you on COBRA, or if you elect COBRA, you only can have it for 8 months without being affected by that Part B penalty. COBRA is typically 18 months, so you would need to do it within the 8 months. I'm sorry, I think I said 18 months. It is 18 months, I'm sorry. It's 18 months, and you need to sign up for it within 8 months, okay? Also, if you are in the VA and for some reason your benefits change, you should already have your Part B in place. Okay, so general enrollment. What is general enrollment for? It's between January 1st and March 31st of each year. So in your case, if you didn't sign up for Part B when you were supposed to, you missed that special enrollment period after your employment ended and your group plan ended, and you missed all those deadlines, and you decide later you want to go ahead and sign up for Part B, you're going to have to do it during the general enrollment period, the period January 1st through March 31st. When you do that, your your Part B will not start until July 1st of that year. So you're going to be without coverage for a while. So it's really best to sign up for your Part B after your group coverage ends. These are the Part B costs for 2020. The 2021 costs were not available yet. So the average cost for Medicare Part B is $144.60 per month. It's typically taken out of your Social Security if you're taking Social Security. There are some different guidelines here, or factors that will have your Part B increase. So if you're basically filing a joint return $174,000 or less, your cost is going to be $144.60, and it goes up as your income goes up. You could start out at $144.60 and have an influx of income throughout the year, perhaps selling a home, cashing in a bank account of some kind. That would increase your income, therefore it would increase your Medicare Part B cost. But after 2 years, it would go back to the average cost base. This is what your Medicare card would look like when you sign up. So obviously it has your name on it, and then they have changed it from the Social Security number to a series of numbers and letters, random numbers and letters, so that it's safer for you. So it's really important, if you have Medicare, that you keep that card with you if you have Medicare and a supplement, and if Medicare is your primary source of health insurance. Also, your card should have Medicare A and B on it. If you get a card that doesn't have both on, you need to check it and see why that is. So there's different parts to Medicare. The Medicare A and B are your general Medicare, original Medicare that covers most of your services. There's a Medicare Part C, which would be your Advantage plan, and a Medicare D, which is your prescription drug plan. You're not always going to have all those parts. You're always going to need to have your A and B. If you choose a Medicare Advantage plan, it's going to combine your Part C. Your Part C will include your A, B, and your D all in one package. And we will go over more of that soon here. So when you're first eligible for Medicare, or even during open enrollment, you can look at what your Medicare options are. There's two options. You either have Original Medicare, which is basically using your Medicare card, or you have a Medicare Advantage plan, which is typically an HMO in our area here in the Alameda County, is an HMO. And it's going to take your Part A and B. You're going to sign that over to the Part C plan, whoever's managing that, and it usually includes drug coverage. We'll go over more of that. We're going to start first with the original Medicare and what that involves. So if you have Medicare A and B, there's going to be some holes in your coverage. Medicare A has a pretty high deductible. It's around $1,900 that you're going to pay anytime you go into the hospital. Okay? Then your Part B covers 80% of your cost, your medical costs. You are responsible for the other 20. So those deductibles and those co-insurances are your gaps in coverage that you want to get covered. Typically with an 80-20, 20% of a doctor visit could be $100 or $200, but 20% of a hospital bill could be as high as $2,000, even higher. So you want to make sure that you're covered. I'm going to back up a little bit and talk about Medicare Part A. Medicare Part A is your hospital insurance. So when you're in the hospital and you're admitted to the hospital, you're in a bed, you're in your room, that is your Medicare A. But when the doctor walks in to see you, he or she is Medicare Part B. If you're having a surgery, your anesthesiologist would be Part B. Any imaging that you have, lab tests that you have, those are all going to be under Part B. So it's important to have both hospital coverage and your Medicare B medical coverage because they work together when you're in the hospital. If you're out of the hospital, everything's Part B. If you have an outpatient surgery, you're in the emergency room, you have any lab work done, that's all Part B. Okay? And Part D is your drug coverage, the drugs that you would pick up at a pharmacy. If your Part D is any of your prescription medications. So those are the different parts and how they work. Now, how the Medigap works with your original Medicare. You have your Medicare card that you keep with you. The Medigaps cover the gaps in coverage, and they're lettered A through N. No matter who you purchase your plan from, if you purchase Plan F through United Healthcare, Anthem Blue Cross, Humana, they're all the same coverage. And there is not a traditional open enrollment period for Medigaps. You need to take your Medigap when you first enter Medicare, when you first get your Medicare Part B. There are some rules and caveats to that, but basically it's best to start out that way. Okay, so this is what the plans look like. We have Plan A through N listed here. There's a few letters missing. The arrows represent the three major plans that most people have, and it's because of the amount of coverage that they have. Also, there's Plan C here, but it's not always sold by all the companies. So Plan F, you can only get Plan F right now, starting in 2020, if you turn 65 before 2020. If you turn 65, 2020 and beyond, Plan G is going to be the highest plan that you can get. They're very similar, except for the Medicare Part B deductible. The Medicare Part B deductible is $198 for the year. Once you've reached that deductible, all your hospital costs, your medical costs, anything covered under Part A and B are covered 100%. What that means is if you go to the doctor and you've met your deductible, your doctor visit will be covered. Your labs will be covered, any imaging, MRIs, x-rays will be covered, emergency room visits, and so on. As long as it's medically necessary and covered by Medicare, then they will be covered by your supplemental plan. Plan N has a couple holes in it. It has the Medicare excess charges that are not covered, and of course the Part B deductible, just like the G. And right here, the asterisks are you would pay a $20 copay at some of your, up to a $20 copay at some of your doctor visits. Typically, when you turn 65, I recommend one of these two plans if you can get the F, or once you come off of a group plan, you could possibly still get the F. Excuse me, go back. Where was I here? And I recommend starting out with this. As you get older, your premiums are going to go up. When you get to be about 75 to 80, you might find that your premiums are getting a little tough to handle. At that time during your birth month, you can talk to a broker, you could talk to a private insurance company and ask them how much it would be for Plan N and see if it would be a good savings for you. But typically, most people start out here. With your original Medicare and then your Medigap, You also need a prescription drug coverage plan. These plans are sold through Medicare, or they're Medicare approved, and you can buy them on the Medicare website or through a private broker. It's important to get your Part D when you're first eligible, because if you decide to do it later, there will be a penalty. It's not as large of a penalty as Part B, but it can be significant, and it lasts you as long as you have Medicare. So how does it work? If you have Medicare A and B with a Medigap, you would want to add the Part D prescription drug coverage. There's several plans. There's, I believe, 34 plans this year offered by private insurance companies that are approved by Medicare. And depending on your coverage, you may have a monthly premium and sometimes a co-payment depending on the prescription or the plan or the pharmacy that you use. So there's a new, it's called a senior savings model with Medicare. There's a few plans that are on it. It's a program that provides coverage in the coverage gap to Medicare. These are the plans that are listed. These probably aren't important to you right now because it's really best to go on the Medicare website. When you go on the website, it will ask you if you want to look at plans that are with this savings model. You could click on that and it will show you these plans, and then you'll know how much your insulins would be. This, I'm sorry, maybe I didn't mention that as well. It's for diabetics because this is what covers insulin. So Part D prescription drug coverage, so as I mentioned before, if you don't take your Part D coverage when you're eligible to do so, you will have to pay a penalty on top of the premium when you do decide to take coverage. Now we're going to talk about Part C, which are the Medicare Advantage plan, and how you choose that Medicare Advantage plan. So we're back over here to your Medicare options. So you have your Medicare A and B, which is going to be your Medicare card, and those are signed over to whatever Medicare Advantage plan you choose, and typically the Part D is included in that plan. Some of those plans offer lower out-of-pocket costs and also extra benefits, such as vision or dental. Oftentimes they're an additional cost within the plan. Within the last couple of years, the Medigap plans as well, with Original Medicare, are also offering those on some of their plans. Again, that's why I recommend when you're looking at a Medigap plan to talk to a broker that might recommend or that might sell multiple company plans, right? And over here, with your Medicare Advantage plan, if you live in Alameda County, there used to only be 3 plans. It was really easy to look at them. You could look at them quickly. You could see who's taking what and choose. I think there might be around 18 plans this year. So you're going to have to do a little more investigating. So what do we want to look at when we are thinking about going on a Medicare Advantage plan? So these plans are offered by private insurance companies, but they have to be approved by Medicare. You don't use your Medicare card anymore once you sign up for these plans. You put that away. You still want it. You still need it, but you don't use it. And you are going to be paying a premium. But you've signed that Medicare over to your Advantage plan, so they're going to take care of you. So with the Medicare Advantage plan, they have to cover all the services that Original Medicare covers except hospice care. That's already covered under A. The Medicare Advantage plans may offer extra coverage such as vision or dental. They also sometimes have a gym membership. And each plan can change different or charge different out-of-pocket costs and have different rules on how you get service. These rules can change each year. That's why we want to look at them during Medicare open enrollment. So you need to ask questions and do a little research when you're choosing a Medicare Advantage plan. You want to know what medical groups are included in the plan. Once you know that, you want to ask your doctor if they are in the plan. If they're in the plan, you want to know what group they are within the plan. What hospitals are there? Does the plan cover the prescription medications that you're currently taking? What are the co-pays and co-insurance, and what is the maximum out-of-pocket limit? If you choose a Medicare Advantage plan during open enrollment, you can change after December 31st between January and March and switch back to your Original Medicare and join a Part D drug plan. So if you are thinking about switching over, That's okay. If you get into the plan, you get the information, you find it's not going to work for you, you can drop that plan in that period. So I want to talk to you a little bit about the differences between the Medigaps, the original Medicare with a Medigap, or a Medicare Advantage plan. They're both very good. You're going to be covered very well with both. The big difference is, with original Medicare and a Medigap, you could go anywhere in the United States that takes Medicare has to take your Medigap plan. So if you choose for example, United Healthcare Plan G, and you're traveling throughout the United States, you can go anywhere that takes Medicare. They're going to take your supplement. You don't have to ask if they take your supplement. If they take your Medicare, they take your supplement. So if you're here in California and you find you have a medical condition that you want to check out a facility in another state, on the East Coast, anywhere, and they take Medicare, you can go there. When you have a Medicare Advantage plan, you might save money monthly, but you can only go where the group is. So if you are buying it within your area, you need to stay within your area. If you're traveling, you don't need to worry about getting services. If you're traveling and you get sick or you have an emergency, you will be seen. You will be seen and you will be covered, especially if it's an emergency. But you can't choose to go to another doctor that's outside your group just to be seen for a medical condition. Only if it's an emergency if you're traveling. Okay, so some medications are covered under Part B. Medications that are covered under Part B are typically, if you're in the hospital, any of your regular prescriptions that you're given in the hospital, those are going to be covered under Part B. If you use drugs in a durable medical equipment, such as insulin that's used with an insulin pump, your insulin would be covered under Part B. If you have a nebulizer and you have medicine that goes in the nebulizer, you're going to pick those medicines up at the pharmacy, but they're going to be covered under Part B if they go into an insulin pump. Any injectable osteoporosis drugs, injectable and infused drugs such as chemotherapy, those are covered under Part B as well. Oral end-stage renal disease drugs and enteral nutrition, all covered under Part B. Also, extra help. If you meet certain income and resource limits, you may qualify for extra help from Medicare to pay for the cost of Medicare prescription, premiums, drugs, and it also may cover your Part B premium. How do you know if you can get extra help? You can call Medicare and find out what the income limits are for that. Oftentimes, if you qualify and Social Security will pick that up, they will send you an application for extra help. If you receive it, you should go ahead and fill it out and send it back because you may not know that you qualify for it. Scams. So during this time of year with open enrollment, especially with COVID-19, we're starting to see more robocalls come up again. They had gone away and now they're back. Just be really careful with calls that you didn't initiate, and please don't give out your Medicare number or your Social Security number. You should never do that. When Social Security contacts you, they're going to send a specific number in the mail to you that they're not even having you tell them on the phone anymore what your Social Security number is. They have an encoded number that when you give them that number, they can look it up and they can see what your Social Security number is. So there's never any reason to give that out over the phone. Also, your Medicare number. There's been some COVID scams talking about as vaccines may come out, if you want to get on a list, you can give them your Medicare number, and that's how you get scammed. So just be really careful. Also, there's people who may come to your door, knock on the door about it. Don't talk to them. All right. So now I just want to give you my contact information. This is my direct line to my desk, and there's my email, and I'm happy to answer any questions. Just give me about 72 hours. Right now, with Medicare open enrollment, I'm pretty inundated with phone calls, and I'm taking a lot of appointments. If you'd like to make an appointment to review your drug plan, I can do that, and I can also answer any questions about tonight's presentation.
Okay, we have our first question. How safe is it to visit you in your office for an appointment?
It's very safe. I'm actually not meeting people in my regular office. I'm meeting them in our old health resource library here at 2500 Maury Avenue, Washington West. When you come in, you're going to be screened by one of our screeners, given a fresh mask. The room I'm meeting people in is a very big open area. I have you about 10 feet away from me with your own screen, pens, and anything you'll need.
Each year, I help my mom with her open enrollment, but I moved out of state before the pandemic. Are you offering virtual appointments or phone appointments so that I can join?
Yes, I am offering phone appointments. I'm not doing any Zoom appointments, but I am doing phone appointments. And if you want a phone appointment and you're going to need time to review plans and such, that I could print them out and send them to you, give yourself, I would do it in mid-November so that we have enough time to get you signed up by December 7th.
Great. You have been very helpful helping me with my parents through open enrollment. Are you allowing other people, other than the clients, attend appointments?
Yes. Oftentimes, a family member will come with a client who is on Medicare just to have a second set of ears, and we are absolutely letting extra people in.
Okay. I am new to learning about telehealth telemedicine. When choosing an Advantage plan, should I ask if this is included?
Yes, you should ask that with an Advantage plan. So Medicare does cover telehealth appointments. But with an Advantage plan, they also can charge a copay. If you have Medicare with a Medigap, there would be no copay as long as you've met your deductible. But Medicare is saying that telehealth appointments are the same charges as if you saw in person.
Okay, and our last question for the evening. If I make changes and I want to go back to my original plan after January 1st, do I have to wait till July 1st?
No, you do not have to wait till July 1st. So if you make changes during open enrollment to a Medicare Advantage plan and you decide that you don't want that anymore, you can change in the January of that next year to March 31st, and it would be effective the next month.
Great. Well, this concludes our program for this evening. Thank you, Kristi, for your expertise, and thank you to our viewers for tuning in. The entire broadcast of today's event will be available on our Facebook page. We look forward to hosting more Facebook Live events in the future.
Thank you.